Good morning. It's an honor to be asked to participate in this meeting and to represent NIOSH. For those of you who may be unfamiliar with NIOSH, we are the U.S. federal agency that conducts research and makes recommendations to improve worker safety and health. Our mission is to generate new knowledge and to translate that knowledge into practice for the betterment of workers. My objectives for this presentation are to provide updates from the Firefighter Fatality Investigation and Prevention Program and share highlights from other NIOSH research and activities relevant to firefighters and emergency medical services workers. First, updates from the Fatality Investigation Program. This slide shows the teams that contribute to the program. They include a team that investigates injury deaths, a smaller team that investigates heart attacks and other medical deaths, and a team that evaluates potential contributions of SCBA failures to firefighter fatalities. After several years of being understaffed, the injury investigation team has added a couple of investigators, including Tom Hales, who previously led our investigations of medical deaths. Tim Mariner, who leads the injury investigations, Wendy Dick, who now leads the medical investigations, and Jay Tarley, who leads evaluations of SCBA, are all participating in the symposium. I encourage you to follow up with them if you have questions and would like to discuss the program. Based on data from the U.S. Fire Administration, since the first full year of the NIOSH program in 1999, there have been more than 2,000 deaths of firefighters, excluding deaths associated with the World Trade Center attack, an unacceptable and tragic number. We do not have resources to conduct investigations of every firefighter fatality, and thus we've identified priorities for investigation. Current priorities include events involving multiple fatalities, deaths in structure fires, and sudden cardiac death during fitness and emergency response training. We have completed investigations for 710 deaths, or 35% of firefighter fatalities since the program began. This is a screenshot of the program webpage, and the address is at the bottom of the slide. The website includes a list of pending reports and links to every fatality investigation report and publication. This website is among the most visited of the NIOSH websites, with nearly 200,000 views each year. This figure, which is available on the website, shows the number of firefighter fatality investigations that we've conducted by state. Investigations have been conducted in every state. The shading darkens with increasing numbers of investigations. States in deep blue are those in which we have conducted more than 15 investigations. If you go to our website and click on a specific state, the website will generate a list of all investigations conducted within that state. This slide shows a screenshot for an interactive website in which you can generate maps, charts, or case listings for variables of interest to you. The map on the slide shows the geographic locations of firefighter deaths in 2016 based on U.S. Fire Administration data, and indicates one completed NIOSH investigation in blue and those with an ongoing investigation in yellow. The web address is at the bottom of the slide if you'd like to check this out. This and the next slide include key findings arising from medical fatality investigations conducted by the program. Our investigations show that annual medical evaluations remain important. NIOSH continues to investigate deaths of firefighters with known history of heart attack who did not meet criteria for full duty, but nonetheless were working with no duty limitations. Investigations also demonstrate that use of the Framingham risk score of hard coronary heart disease is insufficient when identifying at-risk firefighters, as it only considers risk for heart attack or sudden death. NIOSH encourages fire departments to use risk scores that better ascertain firefighter risk by considering coronary heart disease and cardiovascular disease, and we are very pleased that the WFI task force also supports this, and that this will be reflected in the 2018 edition of the NFPA Standard on Comprehensive Medical Programs. In addition to producing reports for each investigation, we also develop safety advisories and summary documents based on findings from multiple investigations. The following slides show publications since the last Redmond Symposium. This is a safety advisory which was published in November 2015 to bring attention to risks to firefighters working on roofs that contain translucent corrugated roof panels. This safety advisory was based on the death of a Colorado firefighter who fell through such a panel while searching for fire extension. We released this safety advisory prior to release of the full report to bring attention to this hazard, which had not been widely publicized in the fire service. This is a picture of a Workplace Solutions released in December. Workplace Solutions are short, easy-to-understand documents that summarize our recommendations for specific workplace hazards. This document summarizes findings from multiple investigations of firefighter deaths during training and makes recommendations for controlling risks for both cardiac and injury deaths. We are aware of a variety of ways in which our fatality investigation reports and publications are used to improve firefighter safety and health. One of the ways is by influencing NFPA standards. NIOSH staff participate on multiple NFPA committees to help ensure that the committees are aware of relevant investigation findings and research. Shown on this slide and the next slide are examples of standards that have been influenced by investigation findings since the last symposium. They include standards on fire department occupational safety and health programs, safety officer qualifications, emergency services incident management, comprehensive medical programs, which I previously referenced, and health-related fitness programs. Two standards shown on this slide are under development. NIOSH staff have participated from the inception of these committees and have provided reviews of relevant fatality investigations. NFPA 1700, a guide for structural firefighting, is slated for publication in 2020. NFPA 1802, a standard for handheld radios, is slated for release next year. I will talk a bit more about NFPA 1961, the standard for fire hose, a few slides from now. Fatality investigation reports and publications are also used in education and training and to change fire department policies and procedures. Investigation reports have been used as case studies in firefighting textbooks, and nearly every month we hear of fire departments using our reports in training and in development and modification of department policies and procedures. Shown on this slide is one example, a calendar developed by firefighternation.com that includes information on death of firefighters from years past and includes links to NIOSH reports. Firefighter Nation encourages fire departments and firefighters to review the reports and learn from them, asking if a similar incident could happen in their fire departments and steps that could be taken to prevent such an incident. I would like to wrap up this section of my presentation by providing an illustrative example of how one report has been used to advance firefighter safety. The example pertains to our investigation of the March 2014 tragedy in Massachusetts, in which a lieutenant and a firefighter died, and 13 firefighters were injured in a wind-driven fire in a brownstone. Chief James Kane with the Wisconsin, New York Fire Department reports that the Massachusetts report influenced the strategy and tactics that his department used in a wind-driven fire in April 2016, about 2 years later. He reported that the Massachusetts report helped him to recognize the possibility of a wind-driven fire, and it influenced how he directed the fire attack, from upwind while keeping the doors of the home closed. He reported that these tactics quickly reduced the heat and smoke, creating safer operating conditions for the firefighters. We could not be more pleased that the program and lessons learned from the Massachusetts tragedy may have kept Wisconsin firefighters safe that day. And we very much appreciate Chief Kane sharing the story with us. We welcome other examples of how our program is influencing firefighter safety and health, which can be used to help demonstrate the value of the program, as well as fine-tune our efforts to increase impact. The investigation of the 2014 Massachusetts incident also contributed to proposed revisions to NFPA 1961, the standard on fire hoses, which was referenced in a previous slide. Prompted by findings of burn-through hoses in the Massachusetts investigation and previous investigations, we partnered with the ATF, who conducted field and laboratory testing on the thermal performance of fire hoses. Underwriters Laboratory also did testing. Based on this work, NFPA has proposed adding new thermal performance tests to fire hoses in the next edition of NFPA 1961. These are just a couple of examples of how NIOSH firefighter fatality investigations have contributed to improve firefighter safety at the local level and nationally. I would now like to turn to additional NIOSH work with relevance to the safety and health of firefighters and emergency medical services workers. Shown on this page are two NIOSH web pages that provide useful resources for NIOSH research pertinent to firefighters and EMS. The slide includes the address for each. The first is a directory of NIOSH resources for firefighters. It includes links to the Fatality Investigation Program and other NIOSH research, including the Cancer Study, SCBA, Wildland Firefighting Resources, and the World Trade Center Health Program. The second is a website focused on EMS workers that includes data on EMS worker injuries, publications, and information on ongoing research to improve EMS worker safety. The Health Hazard Evaluation, or HHE, is a NIOSH program by which employees, union officials, or employers can request an evaluation of possible health hazards associated with a job or workplace. There have been a considerable number of HHE evaluations of fire departments over the years. Since the last Redmond Symposium, these have included an evaluation of heat stress during training and a couple of evaluations of diesel exhaust exposures in fire departments. Reports for these and previous HHE evaluations in fire departments and information on requesting an HHE can be found at the website address on this slide. We have a couple projects addressing turnout gear. These projects address concerns about potential health effects from the firefighter exposure to dirty and contaminated gear, a limited understanding of methods and agents to remove contaminants, and an interest in developing criteria for the retirement of gear based on performance rather than age. The first project is seeking to identify effective cleaning procedures for turnout gear and personal protective equipment. The project involves the identification of chemical and biologic contaminants on gear, devising methods to replicate contamination in the laboratory, validating lab methods against exposures seen in the field, applying lab methods to assess the effectiveness of different cleaning procedures, ensuring that these methods can be used by third parties, and setting criteria for effectiveness. Jay Tarley, who is leading this project, is participating in the symposium if you have questions or would like to follow up with him. We also have a project to help move beyond the arbitrary recommendation to retire turnout gear after 10 years. Stakeholders have expressed an interest in transitioning to performance-based criteria. Performance-based criteria will better help ensure that turnout gear are retired prior to loss in performance and have the potential to extend the time in service for smaller fire departments with lower frequency of use. Factors that are being explored by this project include repair history, frequency and types of laundering, number of structure fire calls, and a variety of performance measures, including thermal protection, heat loss, and the ability of gear to resist breaks and tears. We have a long-standing partnership with the Department of Homeland Security and others to improve the safety of ambulances by conducting crash tests and recommending test methods. 10 new test methods have been published that will drive improvements in the ambulance body, seating, the patient cot, cabinets, and equipment mounts. These test methods have been incorporated into national standards, including those issued by the Federal General Services Administration, NFPA, and the Commission on the Accreditation of Ambulance Services. To help wrap up this project, NIOSH and partners have released a 7-part video series that provides background on the project and the many changes impacting the design, testing, and manufacture of ambulances. This video series can be used by fire departments to make informed purchases of ambulances, and the link to the video series is at the bottom of the slide. The final NIOSH activity I would like to bring to your attention is an emerging issue for emergency responders: exposure to fentanyl and associated synthetic drugs. EMS personnel and others in the fire service have the potential to be exposed to these very potent and dangerous drugs when responding to drug overdoses or hazmat responses. Exposure is possible through inhalation, ingestion, including touching mucous membranes such as eyes, nose, and mouth, and absorption through the skin. More research is needed to better understand routes of exposure and means to prevent such exposures. We have released interim guidance based on the best currently available information. We also recently published a blog requesting information from law enforcement and emergency medical services personnel about the safety and procedures and practices that they use, their knowledge about the effectiveness of these practices, and our interest in conducting health hazard evaluations related to fentanyl exposure. I would like to wrap up by emphasizing that my presentation includes highlights of NIOSH work on the safety and health of firefighters and EMS, and it's not comprehensive. I encourage you to stop by the NIOSH booth, follow up with staff, and check out our web pages to learn more. Finally, I would like to express on behalf of myself and my colleagues at NIOSH sincere appreciation for the opportunity to make contributions to firefighter safety and health. We are very appreciative of our partnership with the IAFF and look forward to continuing to work together to improve firefighter safety and health. Thank you for your attention, and thanks for all that you do day in, day out.